Well, good afternoon. When I finished my doctorate at Oxford and went over to Pittsburgh to become a division chief at the University of Pittsburgh, I used to travel a lot from Pittsburgh to Philadelphia. And when you come close to Philadelphia, there is a sign on Schuylkill Highway, which actually used to really be a source of absolute excitement for me. And the sign was by the University of Pennsylvania. And it read very simply, "We write what others read." And what that meant was that they actually create new knowledge that others then practice. And that is what DHR is doing. That is what Dr. Akala talked about. That's what Dr. Singh talked about. And all the physicians and the investigators who came in front of you today talked about. That we are leading, we are not following. We are creating new ways of how we can actually treat patients with different diseases. And for that, I'm and being part of that particular enterprise is an honor for any one of us, especially for me. Let me take a few moments to thank you. First, let me thank you for being here today. It has been a long day. We brought in front of you some of our very best physicians and investigators to talk to you and engage you in what is an ongoing public health crisis in the region, hoping that you will actually go back to your home and be a source of influence, not only within your family, but also with your peers and with your friends and in the neighborhood. Go and talk to them. Tell them what you have learned today. You are privileged to be here today. Being selected to come and be part of this particular engagement is huge. You are just 175 or 180 students. But can you imagine 175 or 180 students' families, friends, and peers were influenced today? And that is extremely important. So please don't take all this information and just let it sit with you. That would be a catastrophe. Go and talk to your parents and your loved ones and your friends and your peers. I would also like to thank the leadership of the school districts from which you came. Clearly, they saw the vision and the need for such a thing to happen. I would also like to thank the leadership at Region 1, particularly its Executive Director, Dr. Solis, and also the two Gear Up directors. Ricardo is right there, and Ricardo Lopez, and where is our friend Nicole? Nicole and Ricardo have been working very closely with us. They understand the need. Because of COVID, we had to limit this engagement. Hopefully the COVID is going to be over, and then we would like to actually have this entire hall of 900 seats be available to you so that we can actually impart this engagement conversation to a larger group of people. There are staff from the Region 1 who helped us put this thing together. We would like to thank them for their engagement all day today and for ensuring that none of you actually get lost. And also then the people who actually in the Edinburgh Conference Center who help us, Joseph, Chris in the back, who were very instrumental in making sure that the things run smoothly. Jerry, who has been sitting there, that poor guy, who has been video recording this throughout the day. I would like to thank him. And please join me in thanking Jerry for all that he is doing. And last but not the least, Dr. Monica Betancourt. Where are you, Monica? So Monica has been, as I said to you, where is she? Here she is. She has been a local, grown up, and brought up in this environment, went out, did her MD, came back, and has been engaged with us at the DHR Health for a long period of time. She is at heart, an educator. And that is what I like about her. And when this opportunity came back in summer to first get engaged with Region 1, She was the first to actually literally volunteer herself for this particular position. And she continues to do a remarkable job. And so I would like for all of us to thank her for her contribution. And then we have 2 interns here. Where is Caitlin and Carlos? There they are. Well, Caitlin will soon leave us. She's going to go to do advanced nursing. But she has been a tremendous source of support for the Institute. In fact, some of the studies that we are doing, particularly the booster study and the post-exposure prophylaxis in patients with COVID-19, she's helping me manage those studies. Carlos has just joined us. He's also a healthcare intern, wants to go into medicine. So here is an opportunity for you. Remember, we have healthcare intern opportunities. Once you finish your high school, come back and work with us as an intern. Most of the interns that we have get paid. Not a huge amount of money, but you get paid. But more importantly, you gain tremendous experience that helps you get into medical school or nursing school or pharmacy or a PhD. Every intern that has come to us has actually had a wonderful post-internship career. Some have gone, 2 of them gone to residency. 1 has gone into a PhD program at Baylor. So I can go on and on and on. So come and work with us. And I'm hoping to see some of you again when we are actually holding our career in Healthcare Day in February of next year, and in the summer when we are going to hold our junior internship program. Again, thank you for your engagement and for being here, and just stay safe.